Hello, this is our oral practical for plyometric and open and closed chain kinetic exercises. Okay. 1. Appropriate instruction of how to use intervention within safe and reasonable treatment parameters. A treatment duration for plyometric exercises. Treatment duration for plyometrics.
I'd have them do sets. Depending on if it's like exercise where they need to be timed, like if they have to hold a position for a decent amount of time, then you can use time, but you can still have them do like a few sets. I'd go like 3 sets of like 10 or 3 sets of 8 to 10.
Yeah, like depending on the intensity of like a plyometric, like if it's like a lot of explosive 100% like intensity, definitely doing like reps and sets, but maybe focusing like more on like because since it's a plyometric, it'd be a strength and power phase. So like maybe like, yeah. Acceptable application parameter, use lower extremity or upper extremity to help. So why are plyometrics appropriate in rehab? I would argue that plyometrics are used in the last phase of the rehabilitation phase, because at that point, the patient has ideally surpassed like the getting out of the pain phase, getting out of the swelling, regained range of motion, regained neuromuscular control and core function, and also have regained strength and endurance function of whatever limb. So let's say, for example, for like an ACL, so plyometrics are used at the very end, and they are used for like jumping off of 1 or 2 limbs, and even to like return to play. They use the single leg hop test, and that's would be considered a plyometric, but also like just doing things at the end of the rehab to kind of rebuild that. So like box jumps and stuff like that. What do you establish before you incorporate them? I kind of said it already, but
Establishing that they're fully like already weight bearing, able to do simple movements like walking in a straight line, running, even already having them do like some cutting. So like if they're able to do like an agility ladder already, then you can start to, I'd say, do plyometrics off of that.
state primary proposed effect. So the effect is to kind of, since it's a why am I blanking the word? Plyometric. Plyometric would be a explosive movement that is used at 85 to 100% of like 1 rep, or just I guess strength in general. And so since it's like a strength and power,
We just finished our
since it's a strength and power phase, the proposed effect would be to increase strength and power, and explosive movements, which is also why it'd be used at the end of a rehabilitation program. Apply rehab intervention. Follow proper protocol specific to using plyometric speed movements specific to your intended target extremity muscle. Demonstrate 1 upper extremity and lower extremity plyometric exercise. Like I kind of talked about already, like when you're doing like a 1 leg hop test, in order to determine if an athlete can return to play or not, I believe the involved limb needs to be within like 75% to when compared to the other limb in terms of like distance. So it needs to be at least 75% of the healthy limb's distance. Other lower extremity plyometric exercises could be like I was talking about earlier, box jumps, box like hop 2 jumps, just anything like explosive. Upper extremity.
Upper extremity could be like throwing with the arm. So like if they're like a baseball player, you could have them throwing with like a resisted band. So like they're not throwing an object, but they're using their motion in a forceful way with a resistance band. How to educate the patient and emphasize the importance of safe and effective self-care treatment.
So like go specifically into these bullets.
State indications and patient goals. Patient goals is to basically get them ready to like return to play. So the plyometric exercises can be semi-sport specific, but it's kind of the phase where it's in between getting them ready for sport specific activities, but also they're progressing towards getting closer to return to play. Was that also, yeah.
Indications is like, why would you do plyometric exercises?
Doing plyometric exercises can help re-educate the body from like an injury. So like you don't use muscles, so it can help re-educate the muscles that maybe the athlete has lost strength in or mobility in, that kind of stuff.
State primary effects to patient, family, friend, roommate. Primary effects of plyometrics are to improve explosive motions and speed of those explosive motions, and those can also translate like on the court, the field, whatever they're doing. It could also increase like their speed of play and like how quick they can like change direction. Monitor patient self-treatment applications. So could they, I guess, do it on their own? Yeah.
Explain the cautions and contraindications using plyometric exercise. State cautions specific to the intervention. A caution would be making sure there's like minimal pain. So like if we're doing plyometric exercises for a couple days, like they should expect a little bit of soreness, but that shouldn't stop them from continue and progress the plyometric exercises. The fatigue in the muscles after plyometric exercises should be expected. Just needs to be a caution, like make sure they're not having pain like at their injury spot. Like if they had a torn ACL, make sure it's like, yeah, I'm feeling that same pain again. But maybe they'll have quad soreness or a little bit of soreness like around their kneecap and the patella.
State contraindications specific to the intervention. Like I would argue that you wouldn't do a plyometric if they haven't fulfilled their strength or endurance phase portion of the rehabilitation plan. So don't progress them too soon because that increases their risk of re-injury. A unique population that may be considered I see.
Unique pregnancy. Populations, yeah, pregnancy, elderly people, because their mobility and fall risk is heightened, so using those more explosive plyometric exercises could be a little dangerous for them depending on their balance.
Sweet. Okay. Explain to educator proper safety and termination protocol. State safety checks specific to plyometric exercises. Then you'd be assured to establish and monitor during plyometric exercises. So like safety checks, just making sure like the patient has enough room in their surroundings to do the plyometric exercise. Kind of going back to my last example, if they're going to do a single leg hop test, make sure they have the distance available to do a single leg hop test. Making sure there's not a lot of crowds or other traffic in the training room that could run into them or they could run into while doing plyometric work. State reasons that would warrant immediate termination of plyometric exercises. They
die if they re-injure themselves, injure another body part, or possibly if they're starting to maybe the plyometric exercises are starting to cause pain in another area. If they fall and have another compound fracture somewhere, got to terminate that.
Sweet. Fist bump. Appropriate instruction of how to use intervention. So open and closed kinetic chain exercises, reasonable. So I'll do exercise duration again. I would argue exercise duration would depend on the goals of the exercise and also what the exercise is. So like a good open kinetic chain exercise is like literally said it in class. What's the body blade? Body blade is typically a more timed. So you could do like 2 sets of 20 seconds, 30 seconds for things like that. But other things like closed kinetic chain exercises, like a barbell squat, that's going to be more like set and rep based, and that will depend on if you're looking for a more endurance phase, hypertrophy, or strength training or strength phase. So the sets and reps will kind of determine on those. Acceptable exercise parameters. Explain important considerations. So.
Important considerations for open kinetic chain exercises is, implementing them. I'd say you can use these like kind of like early on in a rehab process, just to say like they had a shoulder injury, and going back to what Kiana said about like the body blade, their shoulder would have been immobile depending on severity. We'll just go like they fractured it or something, dislocated it. Their shoulder would be immobilized for a while, so using open kinetic chain exercises can help get the muscle, like starting to get the muscle moving again, re-educated, movement in the shoulder joint. And then closed kinetic chain exercises, I'd use those later on in the rehab process, like doing like back squats or even push-ups. Those ones require more endurance and strength, which they'd have once they reach farther or later on in the rehab program.
Primary proposed effects. What are advantages, disadvantages when considering open versus closed kinetic chain exercises? Kind of like what Megan said, like advantages to open kinetic chain exercises is that since a lot of those can be done non-weight bearing, you can do those earlier in the rehab process, whereas closed kinetic chain tend to be more weight bearing. So that would definitely be something that it would be like a good progression from open chain kinetic exercises, just due to the amount of strength and endurance the athlete or patient would need, kind of like what Megan said. Disadvantages, like open chain kinetic exercises, I would argue you would need more equipment for. So, for example, like doing single leg extensions in a ACL rehab with a ankle weight, you would need an ankle weight in order to complete it, unless you were doing it literally with just body weight. Disadvantages when doing like a closed kinetic exercise, sometimes you'll get like patients that, like if we're using Megan's example earlier from like a push-up, those can be pretty difficult even for a healthy individual to do. So sometimes they might be a little bit too advanced with 100% full weight bearing. So just you might have to modify like the amount of weight that is applied in a closed kinetic chain exercise. Demonstrate 2 open kinetic chain and closed chain exercises.
Do you want to do open? I'll do closed.
Okay. 2 open chain. Like I was talking about earlier, single leg extension with an ankle weight. Pretend there's an ankle weight. My knee just popped. But there's that.
Luna farted.
Did she actually?
Yeah.
Fuck. Another one would be like ball tosses. So like just like you could do like 90-90 like ball throws, and that's just them throwing the ball against the wall like that. And like 2 open kinetic chain.
Okay, closed kinetic chain. Scott, don't judge my push-ups, but they're actually pretty good. Okay.
Very nice. Closed kinetic chain. Boom.
And then another one would be back squat. Pretend I have a barbell on my back. Down and up.
Optimal. Amazing. Okay. How to educate patient and emphasize importance of safe and effective self-care during exercise. State indications and patient goals. Kind of like what we said like 1,000 times. Reasons to do open kinetic chain exercises. I guess any of these exercises would be to increase strength and endurance early on within the rehab process in order for them to progress to return to play. Primary effects, goals to patients. I'll just say that again, but it's like we want to increase strength and endurance in order to continue to progress them throughout the rehab process, and then they can eventually return to sport or whatever their daily activities were. So just getting them up to like their original healthy standard. Educate and demonstrate proper exercise.
For
So
both of them, I guess.
yeah.
For that, I guess I'd just make sure to educate like on proper form, because if they don't have good form, then they're not going to be improving in the strength and endurance of certain muscles that need to be strengthened. Yeah, basically more on form. Yeah.
Yeah.
What tools they might need. So like if inform them if they need to have an ankle weight, bands, weights, yeah.
Monitor self exercise, like, yeah, as long as they are instructed properly how to do the exercises and they're like minimal to low risk of re-injury to do on their own. So I would argue like simple closed kinetic chains, and then most of the open kinetic chains would be okay. Cautions, like be careful if the athlete is kind of like what Megan said in the last one, but if the athlete is still having, what are you doing? If the athlete is like still having soreness at the beginning of a strength or endurance phase, just kind of proceed with caution. So if, as long as it's not making the pain worse, I'd say, and as long as it's staying at like a low end range of like 2 out of 10, something like that. Indications?
Contraindications, don't do it if they're still in a cast. That would
That's a
be
good
good.
one.
Or a brace, if they're still like restricted in their range of motion. Oh, Luna, thanks. Yeah, if they're still in like a cast, I wouldn't do these exercises if they can't properly move. Because if they injured their knee and they're still in a brace, they wouldn't be able to perform a straight leg raise because their knee wouldn't even be fully extended. So
Identify unique populations that might be considered at risk to attempt OKC and open kinetic chain and closed kinetic chain exercises. I would think maybe, I don't want to say the same thing you said last time. Maybe like, if they've recently come out of like a spinal cord injury, so they're kind of like semi-paraplegic or something like that. Could, yeah.
diabetes. Or no.
I don't know, honestly. Diabetes, maybe. Check their feet.
If they like
Neuropathy.
maybe they have a
Paresthesia.
condition where numbness in their extremities, doing some of these exercises like a push-up if they have like numbness in one of their arms or whatever, legs.
Safety check specific.
For open kinetic chain exercises, making and closed, if you're using equipment with your exercises, making sure that the equipment is not damaged. If there's like a back squat, like making sure they have equal amounts of weight on the barbell, because if you don't, the barbell's gonna fall off your back and it's gonna be not symmetrical.
State reasons that you would warrant immediate termination of open kinetic chain or closed kinetic chain exercises. Oh no. If it's continuing to make pain worse, we terminate the exercise and kind of take a step back, regardless if it was open kinetic or closed kinetic chain, if it was causing pain and continuing to make pain worse. All done. Okay, thanks. Bye.
See ya.